हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और हम डिस्कस करेंगे मेडिसिन के इन्फेक्शन पार्ट के सम इम्पॉर्टेंट एमसीक्यू। 35-year-old male came to the OPD with a complaint of fever for the past 4 days. The patient is a butcher by profession, handling rabbit meat. The temperature was found to be 99 degrees Fahrenheit and his heart rate was 65 per minute. Further clinical examination showed swelling in the axillary region, which was axillary lymphadenopathy. Frame a diagnosis and pick the option with the organism that is not related to it. Scrub typhus, Echinilla, Legionella, and Coxella prunati. Echinilla is the best answer because the Echinilla organism belong to the gram क्या है negative, gram negative group and HCEK group of organism. Here the question gives hints of patient handling rabbit meat. The tick bites the person, leading to bacteria entering the body of the hunters and axillary lymphadenopathy. Normally for every 1 Fahrenheit rise of temperature above 100 Fahrenheit, PR increases more than, PR कितना increases होता है, more than 10 BPM. But the question shows here the hypothermia and bradycardia. The which sign? Faggot sign, which is in asclerosis in a tick-borne infectious tularemia. Next question, identify the pattern of fever being demonstrated in the graph. Sustained fever, remittent fever, intermittent fever, and relapsing fever. Here the sustained fever, remittent fever, intermittent fever, and relapsing fever. Here the best answer is the remittent fever because the fever never touches the baseline. It not touches the baseline. That's why it's the remittent fever. And if we conclude the summary of pattern of fever, then continuous fever, fever of sustained fever never touches the baseline. Diurnal fluctuation more than 1 degree Fahrenheit. Remittent fever, never touches the baseline. Diurnal fluctuation remittent में कितना होता है, more than 1 degree Fahrenheit. Intermittent fever में it baseline touches the and diurnal variation more than 1 degree Fahrenheit. For example, malaria. Relapsing fever में fever can be developed into the interval for 3 days. For example, rat bite fever and Borrelia recurrentis. Next question, a 50-year-old male patient complains of a fever of 38 degree centigrade for the past 1 month. She denied any travel food infection or pets at home. She is known case of diabetes and hypertension. Investigation showed increased CRP with other normal values. The doctor finds no potential diagnostic clues for fever. What should be the next step in management? FDG PET exclude manipulation of thermometer. This one is the best answer because they get the classic case of pyrexia of unknown fever. Unknown fever. The question denies for any travel or food infection and a history of fever the past month with no potential diagnosis clue helps in the pointing out of pyrexia of unknown fever. Here we give the chart. If the fever more than 38.3 degree Celsius 101 degree Fahrenheit in less more than 3 weeks and no known immunocompromised state, then history and physical examination done. Then if we done the stop antibiotic treatment, corticosteroid, obligatory investigation, ESR, CRP, hemoglobin, platelet count, leukocyte count, and differentiation, electrolyte, creatinine. This one is the. And after that, exclude manipulation with thermometer. Then stop or replace medication to exclude drug fever. If the PDC present, guided diagnostic test. If diagnosis and undiagnosis. Then we done PDC absent or misleading. नन डायग्नोसिस क्रायोग्लोबिन एंड फंडोस्कोपी करेंगे, एफडीजी पेट करेंगे। आप लोग स्क्रीनशॉट करके रख लीजिए, बहुत इंपॉर्टेंट है। इफ़ यू डू द एफडीजी पेट तो क्या करेंगे, सिस्टोग्राफी नॉर्मल एंड एब नॉर्मल। नॉर्मल है तो रिपीट हिस्ट्री करेंगे, फिजिकल एग्जामिनेशन। एब नॉर्मल है तो कन्फर्मेशन ऑफ एबनॉर्मिटी, एग्जाम्पल बायोप्सी कल्चर। देन इसमें टू पास डायग्नोसिस एंड नॉन डायग्नोसिस, हियर आल्सो द diagnosis and non-diagnosis. If the no diagnosis, then we again do. Then no diagnosis, chest and abdominal CT, temporal artery biopsy more than 55 years. Then diagnosis and non-diagnosis. If the no diagnosis, deterioration, further diagnostic test and consider therapeutic trial. Then stable consideration, follow up for new PDC and consider ends. Take the one-time screenshot. This one come in the lung disease, hypersensitivity, pneumonitis, sarcoidosis, acute respiratory distress syndrome and bronchiectasis. Here the given flow, here a volume loop represents an obstructive lung disease, and among the here the given option bronchiectasis is the only bronchiectasis lung disease. The bronchiectasis is the answer. Obstructive lung disease are characterized by obstruction or narrowing the airways. Narrowing the airways. Narrowing the airways, which makes it difficult for air to flow out of the lungs during exhalation. This result of diminished expiratory flow, meaning that it takes longer for the lungs to empty than normal. The aspiratic curve show the scooped out appearance. Scooped out appearance. Addition to the air trapping caused by obstruction, lung volume, particularly the residual volume RP and the total capacity TLC increases, resulting in the shift of curve in the left in the larger volume. This one. Inspiration rate, expiration of flow liter per second. This one is the normal. This one loop shift if right. This one loop shift if left. Inspiration, flow liter per volume and expiration. If you want, you can take a screenshot. Okay, that's all, and thank you and keep revising.